welcome back. An amazing lunch. Burgers without the blood vessels. I hope you enjoyed it. And all of you listening on the internet, please consider coming to our next Advanced Study Weekend, which I'm going to talk to you about in a few minutes, what that is, and some of the guests who are coming. I try and put together new presentations. I do, as a matter of fact. Each Advanced Study Weekend, I put together 2 new presentations. I gave you one on our first evening together about Dr. McDougall's color picture book on food poisoning. By the way, you can find that presentation on my website in about 15 different languages, including French, Spanish, many, many other languages. And you can share that. You could share it with friends. It's no obligation, essentially no copyright protection. My idea is to share the information with you. If you want to print it out in your own paper color picture book, feel free to do it. Any way you can share that information. And the second new presentation I'm going to give you is about arthritis, various kinds of arthritis. And I hope this gets the attention of many of you. This is a very, very common problem, is to suffer from arthritis. And all arthritis means is that you have pain and inflammation of the joints. Doesn't describe anything else. Somebody says you have arthritis, what they're talking about is a joint problem. And those joint problems can come in many forms. When I first started getting interested in diet and arthritis, it was back in 1978. And the reason I got interested was because this brochure was delivered to me. I was just finished with my medical residency. I was just a young doctor practicing internal medicine in 1978. And this brochure from the Arthritis Foundation came to my desk. And as far as I was concerned, or could have been concerned if I was listening to my traditional education, the topic is discussed, it's over with, the Arthritis Foundation has weighed in. There's no other reason to discuss the association between diet and arthritis, because the Arthritis Foundation put out this 3-color brochure in blue telling me the truth about arthritis. And I need not think about it more, because certainly the Arthritis Foundation has fully explored it. All the scientific research has been done, and probably there were 100 or 200, maybe 1,000 papers to make this type of statement about the truth of diet and arthritis. There had to be, because no responsible organization would take that step, which would automatically close the minds of doctors and patients to the subject, because it's been settled. The Arthritis Foundation weighed in, and what they said is the truth about diet and arthritis may surprise you. It is simply this: there is no specific diet for arthritis, no specific food has anything to do with causing it, and no specific diet will cure it. That's the quote from their brochure. Food fanatics and peddlers of health and natural foods may tell you otherwise. I'm here to tell you otherwise. And I'm here to tell you they put no effort into this in terms of science. There were no scientific studies at that time that supported this brochure. In fact, the scientific research to date showed exactly the opposite. That was in 1978. This is 2014. The Arthritis Foundation says today, while there is no specific diet that people with rheumatoid arthritis should follow, researchers have identified certain foods that can help control inflammation. Many of them are found in the so-called Mediterranean diet, whatever that is, which emphasizes fish, vegetables, and olive oil, among other staples. And this is a picture from their website. They note, I don't think that's tofu, they have cheese in their salad, and they have olive oil as a side dish, and I don't see any starches at all in this particular picture from the Arthritis Foundation. Yeah, okay, they made a little progress. Maybe they're telling the story a little bit differently, maybe, but still an arthritis patient or a doctor who may be interested in helping his or her patients use a diet to help their various kinds of arthritis is completely inhibited by taking any action, because it's already been settled by the Arthritis Foundation and their studies and their research, which is none, nothing, no research, no studies, no support. In fact, all the studies which you can find on my website If you go to drmcdougall.com, look under Hot Topics, look under Arthritis, you'll find an article called Diet, the Only Hope for Arthritis. In there I research the scientific data that had been published to that date, and there's nothing new. And you'll see 28 papers that show that diet does cause inflammatory arthritis. And I'll discuss a few of those with you. But everybody knows gout, which is arthritis, a kind of arthritis is due to food. Is there anybody that hasn't heard that? Anybody that hasn't heard the stories of kings and queens that eating high meat diet causes gout? So yes, the Arthritis Foundation has acknowledged this. But the truth about diet and arthritis, to close the door, when obviously there is an exception, which is gout, gouty arthritis. Gouty arthritis does not exist on the kind of diet that we teach. You have to eat like a king or queen or an American to get gouty arthritis. Degenerative arthritis, which is more common, 70% of people, if you take x-rays of their hands, 70% of people over the age of 65 will show degenerative arthritis changes. I'm over 65. I don't know of any of such changes in my body that are present. Could be, if you did a whole bunch of x-rays on me, but so far, I don't see it in me. Maybe I'm one of the exception, maybe I'm one of the 30%. But 70% of people have what we call wear and tear arthritis, which is a normal part of getting older. That's what you're told. It's a normal part of getting older. You can't do anything about it. And there's always some truth to every message. Yes, as we get older, we have some degenerative, we get older. I mean, plain and simple, we get older. That's a fact. You're not going to change that. And the joints will be less resilient as you get older, and they will show the accumulation of damage over 60, 70, 80 decades of life. Yes, it will be present. So all that's true, but it is inevitable and it is uncontrollable. There's nothing we can do about it. Well, you have to look to other parts of the world where people used to eat differently. Back 30 years ago, people used to eat what I call the McDougall diet, a starch-based diet with very little meat and no dairy and just a tiny bit of oil. And that was in parts of the world such as rural Africa and Asia. Now, these are people that are hardworking. They're on farms. They're working all day long in the fields, harvesting crops, tilling the soil, carrying heavy baskets, carrying heavy loads, and yet degenerative arthritis, which is a normal part of getting older, just wear and tear, is rare in these countries. It is. In fact, here's a publication on osteoarthritis from 1975, which tells you that this disorder in rural Africa is very rare. In people, I mean, how do we get degenerative arthritis in our society? From knitting, from writing with, I know it's computers now, just plugging the keys on computers. That's the wear and tear that results in degenerative arthritis in our society is hardly anything at all. It can't be from normal, everyday physical trauma. Yes, major trauma, you can get degenerative changes, no question about it. But just everyday work in the field, 8, 12 hours a day, heavy hoeing, carrying baskets, and so on, doesn't seem to do it in people who are well-nourished. But in our society, people who are poorly nourished, what happens is the nutrition, the circulation, the immunity, and so on to the joints is so compromised that minor activities such as knitting, such as picking up your grandchildren, these kind of normal minor activities result in degenerative arthritis in 70% of the people by the age of 65, where it doesn't happen in people who work very, very hard with heavy loads when they eat a starch-based diet with very few animal foods. Now you ask yourself, is this kind of arthritis reversible? Yeah, it is to some extent. It was published. Dr. Bland published his research in the American Journal of Medicine showing that, yes, you can reverse some of this wear and tear arthritis. I'll tell you my experience. Probably half the people who come to me and say that they have degenerative arthritis. Degenerative arthritis, you know, the wear and tear arthritis that we're talking about due to trauma with the foundation of an unhealthy diet that allows it to occur at such an accelerated rate. I would say about half the people who see me with that kind of diagnosis, degenerative arthritis, about half the people say, I'm better, my knees stopped hurting, My back stopped hurting. My shoulder stopped hurting. I'm just guessing, half the people. Not as many as occurs when you have a different kind of arthritis, which is inflammatory arthritis. I'm telling you, there is some hope just for the fact that you'll lose all that extra weight that's damaging your hips and knees and ankles. I mean, every doctor, when you come in with hip problems or knee problems or ankle problems, and you're told you have degenerative arthritis and you may need a knee or hip replacement, every doctor either thinks or should say to you, yeah, you know, you ought to lose 50, 60 pounds too. So just for the fact of losing the weight that continues to damage those lower extremity joints, you would want to change your diet. But in addition to that, I think there is some healing. It's not as major as I'd like, but some healing from better nutrition to the joints, improving the immunologic issues. With degenerative or chronic arthritis, there's always some active arthritis. There's always some inflammatory portion of that disease going on, and that I think you can make a difference with in terms of diet. But you're going to be left with a lot of residual. Don't kid yourself. You know, there are changes that plain and simple are not going to go away. Now let's talk about inflammatory arthritis. We talked about gout, which is due to uric acid, which is due to high meat diets. You're all clear on that. Everybody knows, including the Arthritis Foundation, this is caused by rich food, as always has been. And then we have the degenerative arthritis, which is, quote, wear and tear, which I told you has a dietary foundation to it too, not just the obesity, not just the extra weight, but circulation, other factors that nourish the joints. So you have that important improvement you can make with osteoarthritis or degenerative arthritis. But what I want to focus on for the rest of the presentation is inflammatory arthritis. Acute arthritis, hot, red joints that are actively inflamed under several kinds of conditions. Their names go with such names as psoriatic arthritis, rheumatoid arthritis, lupus, non-specific inflammatory arthritis. This is active disease, and this is what you can make such a huge difference in. And this is what I want to talk to you about for the next few minutes. I reported on this in my May 2014 newsletter. I reported on 10 severe cases of inflammatory arthritis. Now, if I'd have done that 20, 30 years ago, my colleagues in my community would have stood up and identified me as a quack, hurting people by falsely leading them to a path of diet and arthritis, which the Arthritis Foundation clearly said is untrue. And he really does until this day. They don't give any significant, any important emphasis to the patient or the doctor who wants to explore this point of view. They would have gone after me. But I published 10 cases of severe inflammatory arthritis in my May 2014 newsletter. I didn't even get a comment, nor will I, because the evidence is so clear, so overwhelming, the connection between these inflammatory arthritises and diet, that nobody would ever take that stand. Nobody would ever step up. Nobody would ever come out and try and protect you, the patient, from someone who would suggest that diet had anything to do with disease. It's a different time, folks. These inflammatory arthritis, they're modern diseases. Some researchers believe that arthritis didn't exist. Inflammatory arthritis, like lupus, psoriatic arthritis, rheumatoid arthritis, did not exist before the 1800s. And it's well documented that these diseases were rare to non-existent in Africa and Asia up until recently. And as recently as 1957, there had been no cases of rheumatoid arthritis found anyplace in Africa. But that's all changed in Africa. A report from 1975 on inflammatory arthritises, such as rheumatoid arthritis and ankylosing spondylitis, found them to be rare to non-existent in rural Africa. But that's not the way it is today. African Americans today are very sick with inflammatory arthritis. As a matter of fact, the black in our country, the United States of America, has the highest rate of lupus, which is an inflammatory arthritis, of any racial group in the country. So what happened to the black from the time in Africa to the transition to the United States of America? What happened? They didn't change their genes. You know, bad luck was not part of the factor. The thing that changed between the rural African diet and the diet of the modern African American, what changed was from a starch-based diet with fruits and vegetables, very little meat, no dairy, to the typical American diet that is loaded with these foods. And the African American, the black in this country, among racial groups, are some of the sickest people in the country, with high blood pressure, obesity, double the risk of breast cancer, and horrible rates of inflammatory arthritis. Plain and simple, because of the change in diet. Same thing, low prevalence of rheumatoid arthritis in China. But that's China of old. I have mentioned to you that we have data. In fact, you can see. I mentioned to you that I was in India just a month ago. I have not had the experience of going to China. But I know what I would see because I've flown on airplanes with citizens of China sitting next to me. I know what I see, and I know what the statistics show. Even though inflammatory arthritis was virtually non-existent before the 1980s in China, it's an epidemic today, just like multiple sclerosis and obesity and diabetes. The Chinese were reported in the Journal of the American Medical Association in September of 2013 to have the highest incidence of type 2 diabetes of any country in the world. India is right behind. The United States is right up there. But these countries that the citizens can still remember a time when nobody was sick, nobody was fat, nobody had inflammatory arthritis, nobody had type 2 diabetes. They can remember grandma and grandpa. We can't. It was too long ago here in the United States, but they can. In China, for example, fewer than 1% of the population had diabetes before 1980. Now they have the leading incidence of diabetes in the world in China. What happened? They changed their genes, bad luck, the wrath of God. They changed their food. They become one of the richest nations in the world, as has some of the economic societies, the advantaged parts of India. They become some of the richest people in the world. They're fat, they're sick, with diabetes, heart disease. I've been there, I've seen it. You can watch documentaries. The only thing that's changed is the food. Oh, back when the Arthritis Foundation was telling us the diet had nothing to do with inflammatory arthritis, there had been multiple studies done. Let me state that again. Multiple papers published in respectable medical journals about cases of inflammatory arthritis, like rheumatoid arthritis, psoriatic arthritis. Case presentations in major medical journals like this British Medical Journal published a case of a person with rheumatoid arthritis who got better when they gave up dairy products. And if you go to my website and you look under the heading Hot Topics, Arthritis, you look up diet, the only hope for arthritis, you'll see the review of these multiple papers, some of them being case studies, some of them being some observational studies looking at people, 20, 30, 40, as many as 100 people. But finally, a long time ago, 23 years ago, there was a randomized, single-blind, controlled trial done using a vegetarian diet, a vegan diet, and rheumatoid arthritis. And it was published in what I would say arguably is the most important medical journal in the world. I like the British Medical Journal a bit better. Lancet would come in second for me. But it certainly has the reputation as, if not one of the most respected medical journals in the world. And the Lancet published in 1991 a controlled trial of fasting and 1-year vegetarian diet and rheumatoid arthritis. What they did is they fed them a juice fast for about a week and then kept them on a vegan diet. And those who followed the juice fast and the vegan diet, they all got better. They all got positive responses. And those who got better stayed with the diet by and large. Those who were in the control group didn't stay with the diet. And that's what they showed in a follow-up study of these vegetarians that were treated, of these people who were treated with a vegan diet 20 years ago. Nothing's changed. There are no studies to say the opposite. There's no research out there to tell you that this is not true. But there's no money out there to promote this science. even though people's lives are at stake. This is a deadly disease. After 20 years of having rheumatoid arthritis, about half of the people are disabled or dead, even with the best drug therapies available. This is a deadly disease. We published a study back in 2002. It was a study of a very low-fat vegan diet on people with rheumatoid arthritis. It was, you see the lead author there. We did this study. We paid for the study. We got it published in a peer-reviewed medical journal showing that people with rheumatoid arthritis, active disease, if we changed them to the diet that you're eating now, they got better. But still, nobody responded. Let me explain to you how you get these inflammatory arthritises. The first thing you have to do is you have to have a leaky gut. A leaky gut. In other words, you have an intestinal tract that is very discriminating as to what gets into your body. It doesn't act like a sieve and allow anything to go into your body that is in your diet. It filters out. It's an intelligent lining that makes decisions as to what gets into you and what doesn't get into you. If you look at this diagram, what you'll see is you'll see the intestinal lining. It is made up of kind of folds. They're called villi. And separating the food, which is at the very top of the diagram, the food that's in the intestine from the inside of the body, which is represented by the dark coloration, and the blood vessels, the lymphatics, the veins, and the arteries, the blood vessels separating the food from the inside of the body, you have to pass through this intestinal barrier. It is not a sieve. It's a discriminatory a barrier that determines what gets in and what doesn't get in. The first step in causing these inflammatory arthritis is you have to inhibit, you have to damage this discriminating lining, this one cell layer, you have to damage it, and now things get into the body that shouldn't be into the body, and primarily what we're talking about getting into the body are animal proteins. Now, there is a condition called celiac disease, which is a big hit these days, talking about gluten and celiac disease. It is a true condition. And if you have celiac disease, which occurs rarely, maybe 1 in 250 people, certainly fewer than 1 in 100 people has celiac disease. Now, what happens when you eat wheat, barley, and rye, you consume a gluten moiety, a gluten protein, which in these few people, fewer than 1 in 100, maybe 1 in 250, maybe fewer, what happens is this gluten that's in wheat, barley, and rye, not oats, this gluten damages the intestinal lining, so as a result, you develop a leaky gut. And people with celiac disease, true gluten problems, they have a much higher risk of autoimmune diseases, including rheumatoid arthritis, much higher risk of thyroid disease, rheumatoid arthritis, and other autoimmune diseases. So the first step in causing this problem is you have to damage the intestinal lining. Yes, it can be done by gluten diets in people with celiac disease. And as a result, that's one thing that you should look for in terms of solving people's dietary problems, their diet-related arthritis. You must consider the fact that they may have celiac disease. And you may take a step, as we're going to talk about in a minute, of eliminating wheat, barley, and rye from their diet. However, just the general American diet also damages the intestinal lining, causes a leaky gut, causes intestinal permeability. Dietary fat is known to do this. High cholesterol diets are known to do this, and vegetable oils, yes, vegetable oils, are known to do this also. So it's not just a matter of eating a low-fat, no-animal food diet. You also must pay attention to the vegetable oils in the diet. This was brought out by a study on fasting and vegetarian diets that was done on rheumatoid arthritis. They fasted these people, the ultimate low-cholesterol diet, water fast. And as in multiple studies published on water fasting in inflammatory arthritis like rheumatoid arthritis, the patients got dramatically better, almost all of them, dramatically better. And what they did in this particular study is they finished the water fast and then they put them on a vegan diet. Be careful of a vegan diet because this vegan diet was very high in vegetable oils and they relapsed. They relapsed. 42% fat, it was vegetable oil. They relapsed because that vegetable oil is toxic to the body and the intestinal lining. There were a couple people with psoriatic arthritis that did relapse. Otherwise, the ones with rheumatoid relapsed. So it's more than just following a starch-based, animal product-free diet. It also must be low in fat. It's be specific. It must be very low in these vegetable oils. All right, so you've damaged the intestinal lining. As a consequence, things get into the body, which is the next step in causing this autoimmune problem. The body defends itself when foreign substances get into it. And it defends itself in one manner by the lymphocytes producing antibodies. And that's what this slide represents, is a lymphocyte producing antibodies which look like these little Y structures. These are antibodies. And they're specifically directed to foreign proteins. Like, for example, if you get a viral infection, the virus gets into your body. The viral coat, which is a protein, causes an immune reaction. It's foreign to your body. It got into it. It shouldn't have, but it penetrated the respiratory lining or the intestinal lining due to damage of this barrier, like we talked about. You have to damage the barrier, and things get into the body that aren't supposed to get into the body. In this case, we're talking about a virus. You have no problem with understanding this. So you get the virus into your bloodstream. The body makes antibodies as a secondary response. First of all, it wants to keep the virus out. So the respiratory linings, the intestinal linings, they try and keep this flu virus, etc. virus out of the body. But when that fails, now the virus gets into your body, and your body makes antibodies against this viral coat. And it's very specific. These antibodies are like a lock and key. The antibodies produced by the lymphocytes are for specific virus coats, specific sequences of amino acids. And that's why when you get one flu 1 year and you've made antibodies to it, during that flu season, that flu you'll never get again. But the next year, a new flu virus comes along, which has a different protein coat, and you got to start all over again. But the body will make antibodies against that virus that got into your blood. It'll kill those viruses. It remembers that virus. It has a memory. But when a new virus comes into the body, it's got to start all over again. So the body makes antibodies to these foreign proteins. These antibodies largely just attack the virus, but sometimes when you get a viral illness, you also get some arthritis associated with it. You get inflammation, you get other things going on, because those antibodies don't just attack the virus, they also attack various parts of the body. How you get autoimmune diseases, including rheumatoid arthritis and lupus type arthritis and psoriatic arthritis, is a foreign protein gets into your blood. In this case that I'm talking about is beef. Beef is not supposed to be in your blood. This is foreign protein. This is a cow protein. It gets through the gut lining into the bloodstream. Now you have cow floating around your blood. The body thinks this could be a bacterial coat. This could be a viral coat. This is a foreign protein. So it produces antibodies from the lymphocytes that attack this beef protein, as it should, like it would a virus. Or in the case of dairy, it does the same thing. Cow's milk protein now gets into your blood. The body makes antibodies against the cow milk protein. It attacks the cow milk protein as it should. Unfortunately, it's not all that specific. And as a result, not only does it attack the cow milk protein, but it attacks similar proteins in your body. It's called molecular mimicry. And the body will produce antibodies that attack that cow milk protein, but also attack similar-looking proteins on, say, for example, the beta cells, the insulin-producing cells of your pancreas. And now the body, which has made an appropriate antibody to this foreign protein, which is cow milk protein, finds an almost identical in fact, there are identical sequences of amino acids on, say, the beta cells of the pancreas. Now it attacks those beta cells, destroys the beta cells, and you get type 1 diabetes. As it does with the cartilage, the collagen tissues in the joints. And we've shown that in scientific studies. There's cross-reactivity. There's this molecular mimicry where the body will cross-react, for example, with cow's milk protein. You eat cow's milk protein, cheese, cow's milk, etc. And it would happen with goat, milk or whale milk or whatever, any foreign milk. You get it into the body, the protein's in the bloodstream, the body makes antibodies as it should to this foreign protein, but these antibodies, not only do they attack the foreign cow milk protein, but they find similar sequences of amino acids on your joint tissues, and they attack them, cause inflammation, and that's how you get these inflammatory arthritis, as well as a whole slew of autoimmune diseases. It's not just arthritis. These are the autoimmune diseases you're familiar with. These are diseases, when I say autoimmune diseases, you think the body attacks itself. Well, it does. How stupid of the body to attack itself? Why would it do that? It attacks the hair follicles, gives you hair loss. It attacks the spine, gives you ankylosing spondylitis. It attacks the bowel, gives you Crohn's disease. It attacks the muscles in the skin, gives you dermatomyositis. Type 1 diabetes when it attacks the pancreas. Inflammatory arthritis, psoriatic, lupus, various kinds of arthritis when it attacks the joints. These all have in common, the body is attacking itself because it gets damage to the intestinal lining. So these foreign proteins can get into the body, which they're not supposed to be doing, just like the virus is supposed to get into your body. But once it's there, the body makes antibodies to this foreign protein, as it should. But because we have molecular mimicry, in other words, the molecules are copies, they're similar between your own tissues, be it the thyroid, the kidneys, etc., between your own tissues and this foreign, in this case, food protein. That's how you get the autoimmune diseases. Multiple sclerosis is an autoimmune disease, and we just finished a study on diet and multiple sclerosis. One of the most common symptoms with multiple sclerosis, a disabling symptom, is fatigue. So as it is with people with rheumatoid arthritis and other autoimmune diseases. The other dietary issue that everybody recognizes with multiple sclerosis or arthritis or other autoimmune diseases is that people ought to lose weight. You have a higher risk incidence, higher chance of getting multiple sclerosis, the brain damage from an autoimmune disease, a higher incidence of getting it, and you do worse, you have more severe attacks and more progression of the disease if you're fat than if you're thin. Same thing with arthritis, even inflammatory arthritis, and people who have multiple sclerosis who do worse have higher levels of cholesterol in their blood. We've studied multiple sclerosis and diet, and I want you to know these connections are shared with all autoimmune diseases, being too fat, having high cholesterol, and also some of the symptoms and signs are related. And that's why I want to talk to you about an autoimmune disease we have studied scientifically and your arthritis problems. This is a summary poster. You can find it in my July 2014 newsletter. It's about our results on diet and multiple sclerosis at Oregon Health and Science University. It was a one-year, randomized, rater-blinded, single-blinded, controlled trial done by Oregon Health and Science University testing the McDougall diet. People educated right here at this resort and taught a diet on the effects of that diet and multiple sclerosis. Another autoimmune disease, just like your arthritis is. And when you read this particular poster summary in my July 2014 newsletter, you'll see that we showed some phenomenal things. We didn't show everything we wanted to show, but we showed phenomenal things. We showed the diet was safe, which is a big deal. The Institutional Review Board would not approve the study. It took them a year to decide feeding potatoes to people was safe. We showed compliance. We dropped the total fat intake from the control group of 40% down to 15%. We showed that 80% of the people would follow the diet 100% of the time. This is done independent analysis. We showed an average drop of cholesterol of 20 points maintained for a year, an average drop of weight of 20 pounds maintained for a year. And this next week in Philadelphia, we'll present our results on fatigue and multiple sclerosis. Fatigue is a disabling symptom of MS patients, as it is with rheumatoid arthritis patients. 80% of the people run into serious problems with fatigue, and it's a major cause of people quitting their education and their vocation. And yet what we showed, and we're presenting next week, is the fact that changing to this kind of diet, immediately people drop their fatigue symptoms based on 3 independent evaluations. And not only did that fatigue drop immediately, that reduction in fatigue, improvement in well-being was maintained for 1 year. Done it in MS, the same thing would happen in inflammatory arthritis. In those 10 cases of inflammatory arthritis that I published in my May 2014 newsletter, they are case examples that are worth your attention. 3 case studies is enough to publish in a major medical journal. Why didn't I? It would be too much trouble. There's actually a doctor on the East Coast who wants to take these 10 studies, 10 people, and put them in a medical journal, and she can if she has the effort and the time, and she probably does. But I published them for you in our newsletter, which was read by hundreds of thousands of people, which I got no reaction from except positive things. Amy Fellow, very sick lady. She couldn't lift her son out of her crib. She was disabled, completely cured of her rheumatoid arthritis. You can read about her in my May 2014 newsletter.
I had to eat like a lot of like soups and applesauce, and so it began with that, and then it went away, and then it started moving like in my shoulder, and it was difficult for me to do my hair in the morning, get ready, and then it moved to my knee, and it would just move to like different parts of my body, and then that's when we started getting concerned as to what it was, and so we started checking out different doctors. I couldn't wear a lot of like rings or jewelry because it wouldn't fit over my finger. The most difficult was just the walking. I couldn't stand on my tippy toes. It was difficult for me to get to class because I was limping, and I would take Advil, and that never really helped. But yeah, so just basically the limping, and then when it was in my shoulder, I actually called in sick a few days for work because I worked at a shoe store and I couldn't lift boxes, and I couldn't move. The first 2 days I woke up with no pain because I used to always wake with swelling and pain, and it was just hard for me to get out of bed. And so I woke with no pain the first 2 days, and that's when I knew I was like, it was getting better. And so since then, or from then, every day it got better. Sometimes it would be completely gone, but then randomly, like one day I'd get like pain in my finger and my feet, and it took 4 months for it to completely go away, and ever since then I haven't had any type of pain unless I accidentally ingested something with dairy, but then I know the next day it'll affect me.
Julia Baker, 16 years old. Okay, she discovered she couldn't keep up with her mom at 16 years old. She walking down the street, she couldn't keep up with her mom. She was very sick. We developed a relationship. She changed her diet. These are the results she got at 16 years old. Now I followed up with Julia Baker. This has been 5 years. And about a year and a half ago, she started having arthritis problems again. And I talked to Carol Miller Baker, her mom, and to her, and I said, this is not a mystery. I know what's going on. You're at college, you're eating garbage, and you're in trouble. So last week I talked to Mom, and this is what Mom had to say. This is her, Julia Baker at 21. I know this is a distressing photo for a mom to have her daughter look like this. Living life to the fullest. She went from a 16-year-old that walked with a limp, was in constant pain, at times couldn't raise her arms over her head, to a 21-year-old woman graduating from college, living in a pain-free life. You should expect this. Juvenile rheumatoid arthritis. You should expect it. Debbie Cockrell had terrible arthritis. She couldn't get out of bed. She was in a horrible shape. You can read about her in my May 2014 newsletter. Depressed and completely cured. Leslie Crane, she told us, my husband had to stop holding my hands. In bed, I pulled the blanket up with my teeth. I kept pliers at my desk to pinch the ink cartridge in order to remove it from the printer. This was a totally disabled woman who changed her diet and was completely cured of her rheumatoid arthritis.
I couldn't ride my bike, and my son and my husband, every weekend, they wanted to go to ride bikes. I was like, okay, I can go, because the pain was so terrible that I couldn't handle like the bike. I couldn't even support my body in the bike. And the worst thing is I was feeling like it's bad to say this, but like an old lady. I was like, oh my gosh, I can't believe it. I was so afraid. And I was not able to squeeze the bottle of shampoo to put my shampoo in my hair. I was not able to open my medication. Like the first results were within weeks, and like complete results, like where you spend time without feeling any pain. I think it took about 3 months to have like real results, when you say like, oh my gosh, I can't run and my knees are just perfect, and you feel that sensation is amazing when you can go back to run. When you can do this, and when you have this disease and you show others that you can move your hands and your fingers and like this, that's the most amazing thing.
You recognize the background? This is here. Last Advanced Study Weekend program. Paula came to just say thank you. Yeah. Severe psoriatic arthritis, completely cured. You can read about this in my May 2014 newsletter. How often does this happen? Well, it's as close as a half a bottle of whiskey and a hangover. You should expect these kinds of results with inflammatory arthritis.
It started off just being something that I needed to take Advil for to get through the day. Then it got to where it was disturbing being able to go to sleep. Then it got so I couldn't go to sleep or stay asleep. And then it just got so that it was nearly a 24-hour thing where I just would fight to see how far I could get without eating a handful of Advil. I'd take a handful of Advil, get a terrible upset stomach, eat a piece of bread, go from the bedroom to the recliner to the couch, trying to get some relief, trying to get a little bit of sleep. Got to where I couldn't actually go to work because I was so tired. Then I would start getting depressed because I felt like I just wasn't functioning at all. And it just sort of spiraled from there. I got so depressed I even considered killing myself. I didn't feel very much different the first couple of days, but then on the third morning, I got up and realized I had slept. About 2 hours, I think, is what I slept. And when I got up, it wasn't spasms in my hips, my neck didn't give me a horrible headache, my shoulders weren't killing me, and I thought, this is exciting. And then on the 6th day, I got up and realized I had slept over 4 hours, and I felt good. And then after that day, I just sort of started feeling better and better. And it was about the end of, after 6 weeks, that I literally did not have any pain.
This was 15 years ago. Marathon runner, disabled, couldn't run, completely cured of rheumatoid arthritis. Read about it in my May 2014 newsletter. This is one of my favorite rheumatoid arthritis patients. She got in trouble in about 1996. She had problems walking across the room. She was involved in the medical business, and as a result, she had heard that diet had nothing to do with rheumatoid arthritis. And then she went to the rheumatoid arthritis doctor, and the rheumatoid arthritis doctor suggested she start a routine of methotrexate. But she was in the medical business. She was afraid of taking these drugs. She contacted me in about the year 2000 after she changed her diet, told me that she got these tremendous changes, virtually cured of her rheumatoid arthritis. And I said, Phyllis Hafey, I said, let's tell your story. She says, no, I really feel a little embarrassed about telling my story. I don't want to tell it. I don't want to go public. And then she wrote me in 2004, it was July in 2004, she said, I want to tell my story. The reason I want to tell my story is I just got back from Paris with my husband and my 2 children. And we walked all over Paris. Yes, I did have to cook my own food in my room. But I'm completely cured of my rheumatoid arthritis. And I want to tell you that that has happened to me. And at that time, she was 46 years old. And she, like I say, she couldn't even stand.
One day I was traveling to spend some time with my parents who live in a different province. And they, for some reason, for 2 days, I could hardly walk at all. In fact, I couldn't walk at all. And it was so bad that as I tried to walk, I was literally, tears were going, were running down my face through the pain that I was having, and I just didn't understand what it was from. She immediately wrote out a prescription for me. And I asked what that was, and she said it was something called methotrexate. I found out later that that's a drug that is used to treat cancer patients, or a form of it is. But at the time she told me it was a very strong drug, and I would need to take this for the rest of my life. And then she immediately said, now I want to schedule the first blood test for you. And I said, what is that? She said, you're going to have to come back at the beginning. I believe it was something like every 3 to 6 weeks to have my blood tested. I asked, what was that about? And she said that it could have a very adverse effect on the liver unless it was monitored properly. So I guess I wasn't absorbing a lot of what she was saying, but what I did absorb is that it was a very serious drug. But I guess I forgot to tell you that the last thing she said to me is, take your time, and you can, she knew I was going to look on the internet and things. She said, but you'll be back really soon, because really you're looking for some cure through food, and there is none. So that was probably more frightening to me than anything. And so my reaction as I walked out of her office is that I have a terrible disease, and that it was, I guess I describe it as almost like a death sentence. And I don't know, because I didn't know enough about it then, but it sounded like it was grave, and it was something that I really had to deal with quickly.
That was 10 years ago. That was the before. Phyllis Hafey, would you like to come up and tell us how you're doing now?
I don't know, is the mic working? I've got my Kleenex in my hand because I started to cry. I thought, since I only have a very brief time, I want to tell you a story of something that happened about an hour ago. It was beautiful sunshine outside. I had just finished eating, and I said, I'm going to do my 30th walk around this hotel in the last 3 days. And so I went outside, and I go around the periphery, and I come up around this side of the building, and I see the most beautiful flowering bush. Just so beautiful, and it was way up there. And I said, I'm going to take a picture of that flowering bush, and I'm going to put it on my phone. So this is what I did. I'm going to try not to do too much because it's going to disturb the microphone. First thing I did is I was carrying my purse. And so I bent right over, and I put it down on the ground. I made sure there were no cars around me. And then I couldn't get high enough to get the sort of fence out of the way because it was really way up there. So I stepped up onto this sort of curb thing, little narrow thing, which is not a very safe thing to do. And then I just elevated myself on my toes, lifted up my arms like this. And it took me about 3 minutes to get the perfect shot. And I was just, sort of really trying that and stretching out. And I think I got the perfect shot, and it's on my phone. What does this mean? It means none of my joints are hurting me. And they haven't hurt me for 13 years. So I just want to tell you, yeah, I got my Kleenex. And I'm not ashamed to cry about my own, about this tremendous success I've had. And I'm so thrilled to see those wonderful people that they also had success. And I will tell my story to anyone at any time. And it is true.
Thank you, Joyce. Couldn't have been a better testimony. Thank you very much.
Thank you.
You're very brave, very kind to share with us. But this is real, ladies and gentlemen. This is what you should expect, what you see in Phyllis or Paula or any of the other people. It always works. It's like diet and constipation. It's, as I say, it is a cause and effect thing, yet nobody knows about it. Nobody's being told. And it's not like people are trying to be mean to you. It's just business. It's just plain and simple business. So the way you treat it is you treat it with a basic McDougall diet like we served you here this weekend. Delicious foods. Is there any compromise? Is there any lack? Are you giving up anything? Yes, you're giving up a wheelchair, early death, disability, cancer drugs that cost you just for the medication $30,000, $40,000 a year, just for the medicines. We're not talking about the office visits, the lab tests, the loss of employment. Just simple food. You treat it with the basic McDougall diet. Yes, that's what you do. And if you want to take the next step, and that doesn't seem to solve the problem, say go gluten-free. We serve, I don't recall whether we had them on these particular food lines, but we usually do. We have food labeled as gluten-free or not gluten-free. There are a few people who need to take that step. How many? 1 in 100, 1 in 250. But we don't want to miss anybody. So you just eat the gluten-free McDougall diet. There are so many things you can eat. Rice, sweet potatoes, beans, peas, lentils. There's no limitation. But if you have to get a little bit more severe, in fact, there's an occasional person, maybe out of all the people with inflammatory arthritis diseases that I've taken care of over the years, which have likely numbered more than 50, maybe 100, there have been a few people who had to go one extra step. And that extra step was to put them on an elimination program, which is a very effective approach if you have severe diseases and can't solve them with a basic varied food plan that we have. We put you on an elimination diet, which is essentially rice and sweet potatoes as starches, and then you add cooked green and yellow vegetables, cooked, and, yeah, I know, cooked fruits. You don't eat them often, but that's what you have to do. Cooking starts to denature the proteins. A rare person has to go that final step, but it's there, it's available, it's free, it's a solution to the problem. It's far better than taking cancer chemotherapy drugs or worse biologic agents. This is an option you have at no cost, simply to change your diet. And as I've emphasized so many times before, it is the starch solution, not only for individuals' health, but for the community as well as planet Earth. Thank you very much for your attention. We're just going to take a short break, and we'll be back with our next speaker. Thank you.